All right, stop crying. Senate Majority Leader Harry Reid says Republicans should stop crying over the possible use of reconciliation in the health care bill. Senator Reid warns nothing is off the table and that reconciliation, which requires just a simple majority to pass legislation, has been used 21 times before. South Carolina Senator Lindsey Graham joins us. Good evening, Senator. And I guess,
good evening.
Are you crying?
I'm pretty happy. It's a great country.
Okay, you're not crying. All right. What about reconciliations? The Democrats say it's been used 21 times before, so any Republicans who are complaining about it, quit crying.
It's never been used this way. It was never meant to be used this way. You know, we need health care reform, and obviously we need better hearing in Washington, because if our Democratic friends don't understand what Massachusetts was about, that's scary. Scott Brown took Ted Kennedy's seat in Massachusetts, the bluest of blue states, running on the idea that it'd be the 41st vote against this massive health care bill. So what's their response? To accuse us of crying when they try to jam it through with 51 votes and to ignore the American people by making it bigger? I think they've lost their mind.
What are the senators saying behind the scenes? I mean, I know that I hear what everybody says publicly, but when you run into them in the halls, what are the Republicans? I mean, what's the real story among the Democrats and Republicans on this?
Well, this is a little bit of a base politics. The left, who wants single-payer health care and a massive takeover of health care, their ideas were rejected by the American people. The Massachusetts vote, pretty clear referendum on health care, and they're upset and they're mad and they're angry. That happens on the right when our people get upset that we don't get what we would like. But the middle of this country has spoken on this health care issue. Now's the time to come up with some common sense solutions. And behind closed doors, I think reason will prevail. If they do this, Greta, if they try to jam through this bill.
What makes you say that reason will prevail? Because, I mean, the lines have been drawn in the sand. I mean, it's pretty clear. And the things that are said are rather strong on both sides.
Well, I was in the Gang of 14. Remember when the Bush judges were being filibustered, we were going to change the rules. 7 Democrats, 7 Republicans said, slow down. Changing the rules will change the Senate. And, you know, at the end of the day, I want health care reform, but I want a Senate that works and slows down bad ideas and sometimes, unfortunately, good ideas. This will be the end of the minority rights in the Senate as we know it. And the casualty of this whole debate would be the loss of the United States Senate as a real viable institution. It will become the House, and no bill is worth that.
All right, so play this out for me. If you say the reconciliation, nuclear option, depending on who's saying it, what do you want to call it, where it's 51 rather than 60, if that doesn't happen, if it doesn't go to reconciliation, what does that mean? Because it does not seem like the Republicans and Democrats are even remotely close on this particular bill. Does this mean no health care reform?
This means that this big bill will never pass, but there's plenty of room for compromise. There's competition could be introduced into the system to lower cost, legal reform. At the end of the day, a lot of Americans don't have health care coverage because it costs too much. You know, I'm on a bill with Senator Wyden, 7 Republicans, 7 Democrats, mandate coverage, but you get to buy your coverage in the private sector using the tax code. So there's a bipartisan solution to this. It's just being rejected for a big government takeover. At the end of the day, I would counsel my Democratic colleagues not to do this, because moderate Democrats will become political kamikazes if they go down the reconciliation road.
All right, if reconciliation doesn't happen, and thus this big bill this comprehensive big bill won't get passed, the next question is whether sort of like, little bitty steps or little reforms will happen. And at that that's what the Republicans are looking for. But at that point, then do the Democrats sort of dig their heels in the sand and say, we're not even going to do those? Or are they sort of brought to their,
I hope not.
Are they brought to their knees and they've got to do it at that point?
It's not about bringing people to their knees. It's about listening to the public. I mean, how can you say that Massachusetts election wasn't a signal about how the country as a whole feels with this bill? I mean, if we stop listening to the people, we don't deserve our jobs. You know, they've done more for the Republican Party by doing these kind of things than the Republican Party's done for itself. President Obama talks about bipartisanship. If he pushes reconciliation, then everything he said is just basically a fraud. If he wants bipartisanship, you have to go seek it. I'm a guy that does like common ground where I can find it. There are plenty of Republicans and Democrats who have similar ideas about lowering cost.
If it gets to reconciliation, if Senate Majority Leader Harry Reid says, okay, we're going to go the reconciliation route, do you expect, or would you expect President Obama to pick up the phone and tell him not to do that because of all the things that you lay out?
Good question. I would hope that he would, for the good of the Senate, for the good of the country, because the consequences of taking 1/6 of the economy after all the public input and ignoring the public input is arrogance on steroids. It would be really the end of the Senate as we know it. It would be a debacle for health care as we know it, because you couldn't really do it through reconciliation. It would be a move that would have long-term consequences to the country far beyond health care, and I think it would be, quite frankly, a destructive act in American politics not witnessed in a long time, quite frankly.
Senator, thank you. All eyes, of course, are on this Thursday, so anyway, we'll find out what happens. Thank you, Senator.
Stay tuned.
Coming up now.